John Houle is a busy man, a firefighter in Manchester, New Hampshire, and a member of the Pat's Peak Ski Patrol. He's athletic, daring, and tough.
And I slipped on the stair.
So when he slipped and fell on the stairs outside his home last winter, he didn't think much of it.
I got right up and went in the hot tub and went to work.
But a few days later, John's back was still bothering him, and when he spotted blood in his urine, he knew it was something serious. He went to his doctor in Manchester, and after a series of tests, a nurse practitioner broke the devastating news to John over the phone.
She told me that I had a hypernephroma. She spelled it out for me, and she said to look it up on the internet. And I was at work, and I was flabbergasted.
Hypernephroma, kidney cancer. John was devastated and upset to learn such serious news over the phone.
And my wife and I looked at each other and said, that's not right. So we decided to go to Boston.
A family member referred John to Dr. Andrew Wagner, director of minimally invasive urologic surgery at Beth Israel Deaconess Medical Center in Boston.
If he waited 5 or 8 years down the road, this tumor might have been quite a bit larger, might have been much more difficult to remove, and may have even spread to other organs, making it very difficult to cure.
Kidney tumors are considered a silent cancer, showing little or no symptoms until the tumor has grown or even spread to other organs. More than 50% of kidney tumors are discovered by accident, when a patient has an X-ray or CAT scan for another ailment.
In John's case, his tumor was found incidentally, but the size of it and the location of it was such that we couldn't save the kidney. We had to remove the entire kidney.
Traditional open kidney surgery requires a large flank incision, up to 1.5 feet long, through layers of muscle, making recovery slow and often difficult for the patient. Laparoscopic surgery is less invasive, using up to 5 smaller incisions to remove the tumor. But Dr. Wagner suggested a cutting-edge procedure that is even less invasive.
Single incision surgery is only one incision right inside the belly button. And so it reduces the amount of abdominal trauma and potentially reduces the amount of pain and soreness and recovery time that the patient has.
So this is a typical laparoscopic instrument that we use.
Through that one incision, Dr. Wagner maneuvers small instruments into the patient's abdomen. A tiny camera attached to the instruments helps him to see inside the patient and remove the tumor or the entire kidney through that same incision.
It's a very new technology. It's really on the cutting edge, and there are very few surgeons really in the entire country that are doing this.
Dr. Wagner has performed more than 500 standard laparoscopic kidney surgeries and many single incision surgeries. Even though the single incision procedure may take longer to perform, he believes patients may benefit from an even shorter recovery time than regular laparoscopic surgery. Just 10 weeks after undergoing single incision kidney surgery, John Houle was back fighting fires.
Dr. Wagner, his experience was the best that I could have hoped for. He really knew what he was doing.
We have a very unique team approach to kidney cancer here. We're one of the only multidisciplinary kidney cancer centers in the Northeast. You're not just getting one doctor, you're getting a team of kidney cancer specialists.
John says he made the right decision to travel to Boston and BIDMC. He is thankful for family, his medical team, and for what he now calls his lucky fall.
The fall was a blessing in disguise. If I hadn't have fallen, I would still probably have this and I wouldn't know it.